Now time for some medical news. When it comes to cancer, so we've talked about cases rising among younger people, but now we're learning some of the causes related to this. We've brought in our favorite doctor, Dr. Victoria Dooley from Northville Novi Family Medicine. First of all, thank you for being here.
Thank you.
We see, it seems, especially on social media, you know, you look at a TMZ page and it seems like so many people are passing away from cancer at such a young age. And I think people kind of say to themselves, it seems like more people are dying, but we don't really see the numbers and the stats behind it. But now it does seem that that could be the case.
It is true. Bad news for millennials and Gen Xers. We are dying from cancer at earlier rates. However, it's still like less than 1% likelihood that you're going to get any cancer under the age of 50%, like less than 0.5% likelihood. So yes, we are seeing a real rise, but is it a big enough rise to be really fearful? I'd say no.
What's causing this rise in cancer?
Well, the recent study that just came out this week is saying that maybe obesity is tied to the link in cancer. And what we had learned in previous shows is that people are aging quicker, increased biological aging. So that makes sense. If usually older people get cancer and you're young, but your body is aging more, that's why you're getting cancer younger. But some of the things that will age you are what? It's obesity, it's smoking, it's having a sedentary life, it's lack of companionship, isolation. Social isolation will age your body. So obesity seems to be the key culprit in this, but anything that's going to increase stress in your body and make you age faster is going to be a risk factor to get cancer younger.
Can you change your biological age of your body? Can it go up and down?
Yes, some of the things that you can do are some of the things that we always talk about as doctors. You want to maintain a healthy weight. That's why I don't believe that there's something true healthy obesity. You can have obesity and not have high blood pressure or diabetes. However, having obesity over decades, just that alone, is going to increase your risk of cancer. Smoking, drinking too much alcohol, having a sedentary lifestyle, and stress. You really need to manage your stress. Not getting enough sleep. All those things cumulatively are going to increase your cancer risk. So do what you can. Maybe you can't, you know, walk every day, but if you can reduce your stressors, if you cannot smoke, if you cannot drink alcohol, do the things that you can to help decrease your risk.
It seems sometimes people think maybe they're being a little healthier with White Claws and Trulies. And how much does that matter if you're, you know, you're having a skinny cocktail? Is there such a thing, Dr. Dooley?
In general, there is a school of thought that believes no alcohol is a safe amount of alcohol.
Okay.
But in most things in life, it's about moderation. Women absolutely should never have more than 7 servings in a week. So if you're out once or twice a week and you have 1 to 2 servings, if that's the risk you're willing to take, I say go for it. However, should you ever consume more than 7 as a female? No, which is not fair, because guess how many men get?
How many?
14 a week.
14?
14.
No matter their size?
Right. They get 14 a week.
What?
Yes.
Well, that's not fair.
Whatever level you're comfortable with, that's less than 7, that you can live with, I'd say.
Very quickly, I do want to see if we have time to get to this, talk about the FDA. They recently approved a new blood test to screen for colon cancer. So what's the difference?
That's exciting, because right now to screen for colon cancer, you have to get a colonoscopy, which takes a day off of work and a lot of prep that people hate, or it requires a stool test that you have to collect at home, and nobody likes to collect a stool sample at home. So this blood test opens up a third way for people who don't have the time or a driver to take them to get a colonoscopy, and they're not really comfortable collecting a stool test at home. Now you can get a blood test, which is super cool. The bad news is it overall is about 83% accurate in detecting colon cancers, because it looks for colon cancer DNA. But the bad news is in early cancers that are excreting less DNA, it's only about 13% effective. So overall, I'd say if there's any way you can, please get a colonoscopy at 45. If you can't, this is another great option for a lot of people who can't.
Okay, so still highly recommend, though, going in to get the colonoscopy.
Right, but this is a good backup if you can't do that.
Very good. Thank you so much, Dr. Dooley.
Thank you.
For more information, you can head over to our website. We'll link you to Dr. Dooley if you head over to fox2detroit.com/link. We'll be right back.